Welcome to a new episode of Medicine in 3 minutes. As usual, we go start with the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about Lambert-Eaton Syndrome. Lambert-Eaton Syndrome, think about eat the lamb. In Lambert-Eaton Syndrome, it's essential to make a differential with Myasthenia gravis. This is the presynaptic, this is the postsynaptic, this is the synaptic cleft, and there are many crests in the fold of sarcoma. Presynaptic is about voltage-sensitive calcium channel. On the other hand, postsynaptic is about voltage-sensitive sodium channel. Presynaptic, sensitive calcium channel. Postsynaptic, sensitive sodium channel. Lambert-Eaton is a presynaptic disease. Antibodies are directed against voltage-sensitive calcium channel. 50% of patients are associated with lung small cell carcinoma, which is very aggressive and very difficult to treat. Lambert-Eaton syndrome manifests 2 to 3 years before the cancer appears. That means you have to make X-ray every 6 months to detect the cancer before it manifests. The other 50% is associated with autoimmune disease. Vitiligo, antibody against melanocyte. Hashimoto, antibody destroying thyroid. Graves' disease, antibody stimulating the thyroid. And type 1 diabetes, antibody destroyed pancreatic beta cells that produce insulin. Lambert-Eaton, think of girdle muscle, lumbar for lamb, hip muscle, then shoulder muscle, going upstairs or standing up. Gait problem appear before ASI. Less community disease go upward. Sustained effort, transient improvement of power. Investigation include antibody against presynaptic voltage-sensitive calcium channel. These antibodies are also present in cerebellum, giving ataxia. CT scan to detect small cell cancer of lung. Repetitive exam before the installation of the cancer, every 6 months. Repetitive stimulation lead to incremental response. In Lambert-Eaton syndrome, there is no response to hydrophonium. Small cell carcinoma, ectopic production of ADH. Is ADH-like syndrome, water retention, low blood sodium, high urinosmolarity, treat with fluid restriction plus 3% saline if sodium less than 120. High urine osmolarity, water retention, all smoker. Sustained effort, Lambert-Eaton incremental, Myasthenia decremental. How to manage that? Treatment include immunosuppressor, plasmapheresis, and 3,4-diaminopyridine. Don't forget to treat the small cell cancer. Remember, anticholinesterase don't work in Lambert-Eaton syndrome. Myasthenia gravis versus Lambert-Eaton syndrome. Both, there is spineless weakness plus autoantibody and normal sensory system. I repeat, both have spineless weakness, autoantibody are normal, autoantibody, but normal sensory system. For Lambert-Eaton, gait before A, slow fatigue, small cell carcinoma, incremental. Antibody VSCC, ephedrium negative. Treatment with 3,4-diaminopyridine and immunosuppressor. Myasthenia gravis, A before the gait, rapid fatigue, chimoma, decremental, anticholinergic, anti-mask, ephedrium positive, anticholinesterase, and immunosuppressor. Lambert-Eaton is presynaptic disease, antibody directed against voltage-sensitive calcium channel, 50% associated with leg small cell carcinoma. The other 50% are associated with autoimmune disease like vitiligo, Hashimoto, Graves' disease, or diabetic type 1. Detect the cancer because every 6 months by X-ray or MRI before it appears. Sustained effort, Lambert-Eaton incremental, myasthenia decremental. Treatment, immunosuppressor, plasmapheresis, 3,4-diaminopyridine, treat small cell cancer. Don't forget anticholinesterase don't work. Thank you for watching this episode of Medicine in 3 minutes. Make sure to put the like button and subscribe. Your comments are very welcome. Thank you.